Good morning, Professor. My name is Kanchan Rani, and my peer partner for the capstone is Manpreet Kaur. So, the quality and safety health issue in Canada for our capstone is fall prevention. Fall prevention is a major current quality and safety health issue in Canadian healthcare. So, we have chosen this topic because of the higher percentage of fall incidents and because of its severity. So, as per the Canadian Institute for Health Information, the fall incident rate during 2021 to 2022 in long-term care facilities of Ontario was 16.2%, and the Canadian rate during the same time period was 16.4%. It's not only about the higher percentage of all incidents, but also of the severity that it leads to various negative consequences on the health of the elderly people and those who are at the risk of fall. So it leads to prolonged hospitalization and escalation in healthcare expenses. Also, it increases the workload of the healthcare providers and family distress. Next is the solution quality improvements to be implemented. So we have set the target to reduce the benchmark of fall rates from 16.2% to 9%. Also to promote the overall quality of life and to reduce the long-term consequences among the elderly people. So we have come up with the implementation plan, which include the three major interventions. So the first one is universal precautions for all. It includes creating the safe environment, assisting the patient with mobility, and reducing the fall risk. Also engage the client and family while preparing the nursing care plan for the client. The second is multifactorial risk assessment. And this implementation, we are going to assess the patients who are at the risk of fall. And the last is educational seminars in health education. So we are going to conduct educational seminars and we are going to disseminate education to the clients, their families, and also for the healthcare team on creating awareness that how can they reduce the fall incident rate in the long-term care facilities. The evaluative outcome for our capstone is fall rate. So fall rate reduction with the target from 16.2% to 9%, and we are going to measure our outcome through regular assessments and by doing audits of fall rate incidents. And we are going to compare the current fall rates with the basic fall rate, which is 16.2%. Next comes the barriers and overcome strategies. So as per our identification, the barriers that can be occur in implementing the plan our resource allocation. So we are going to overcome this barrier by budget reallocation and by generating the external funding for the plan. The next is staff resistance to the change. So it could be a barrier that staff may resist to the change, but we are going to provide comprehensive training programs to our healthcare team for the successful and effective implementation of our plan. Next is impact on staff, leadership, and patient families. So staff is going to be more engaged and responsive in implementing this plan. And for the leadership, there will be increased reputation and they have to be actively reinforcing and enforcing the healthcare team members to implementing the plan effectively. And there will be increased quality of life and increased satisfaction among the patient and families through this implementation plan.
Our next slide is on Act Plan for Sustainability in continuous monitoring by establishing a system for ongoing monitoring of fall incident rates as well as its consequences, and then by providing regular training to the staff to build up the fall prevention strategies, and by also keeping them updated to the latest protocols, and then by implementing a feedback system for patients as well as for staffs that can provide insights for the effectiveness of the implement strategies. Support required by a leadership, that is continuous training and development. Leadership should invest in ongoing leadership development programs to ensure they are equipped to manage and lead in a healthcare environment. And then is the nursing process theory, in which five systematic steps are included for the client-centered care, which are assessment, diagnose, planning, implementation, as well as the evaluation. And the last one is the transformational leadership style, which is compulsory for the success. Leaders need to inspire and motivate staff, fostering a shared vision of patient safety and quality improvement. Resources required to sustain changes. In this, human resources, financial resources, technical resources are included, and in human resources, adequate staffing to facilitate training. Data collection and ongoing monitoring comes in it, and in financial resources, funding for training programs, data collection system, and technological support for prevention insights. And for technical resources, implementation of technology for data collection and analysis. In conclusion, our success will be achieved by a significant decrease in the fall prevention rate, which will be approximately 9% in Ontario's long-term healthcare facilities, which will be achieved by continuous monitoring, ongoing staff training, and a feedback mechanism ensure the sustainability of our fall prevention efforts, as well as by implementing universal precautions, risk assessment, and education ensures a various strategies to address the fall prevention. Here are the resources that are used by us for the whole capstone, which are Canadian Institute for Health Information. Second one is Health Quality Ontario, as well as the Registered Nurses Association of Ontario. And the last one is the Book of Wagner, which is Leadership and Influencing Change in Nursing. And thank you for watching our presentation.